and welcome to the Dementia Researcher live stream this afternoon, where I'm joined by the colleagues from the SPIND Dementia Network Plus, who are going to be here to talk about their new flexible funding session, or their flexible funding scheme, to give you some information about the SPIND program and about how you might get your hands on some much needed funding to look at dementia prevention, risk factors, and other things. But I'm not going to go into all the detail because I'm going to leave that for them. What I'll do is give you an introduction to the program. So how today is going to work, we're going to start by hearing from Professor Chris Fox from the University of Exeter, who's going to give us an overview of SPIND and what it's all about. Then we're going to hear from Georgina Charlesworth, Professor Georgina Charlesworth, who's going to talk about the Flexible Fund and give us some details about what they're looking for and how you might apply and what you need to do to get your hands on that much needed funding to deliver on some important research. And then we're going to hear from William Lilly from the Health Innovation Network, who's going to talk about some sandpit events which are going to go on over the next year, I think, but the first of which takes place later this month. Well, we'll hear from William on that. So thank you very much, everybody, for joining us. And Chris, shall we do some introductions first before we get round to hearing the talks? Chris, do you want to introduce yourself?
Yes, so I'm Professor Chris Fox, and I'm Professor of Old Age Psychiatry in Exeter, and I'm also one of the Health Tech Research National Directors. Nice to hear from you all.
Thanks, Chris. And then we've got Georgina.
Hi, Georgina Charlesworth. I'm Professor of Clinical Psychology of Ageing and Dementia at University College London and co-lead with Chris of the Sustainable Prevention, Innovation and Involvement Network for Dementia.
And we have William as well.
Hello, everybody. So I'm a director here at the Health Innovation Network Southwest, responsible for overseeing our engagement with industry and also a partner in this fantastic SPIND network and helping us on our innovation sandpits, which I look forward to talking about shortly.
Thank you. And in the background, we've also got Emily here. I'm not sure, Georgina, can I just check? Should we have Emily on in here as well, or for the Q&A?
I think Emily's joining us for the Q&A. Yeah.
Great. Okay. Well, let's bring Emily in. I really want to ignore in the background. Hi, Emily. You want to introduce yourself as well?
I'm Emily Permain. I'm the network manager for the SPIND network.
Fantastic. Thank you. Okay, so that's enough from me. We're going to hear from you first of all, Chris, and I've got some slides here from you, so I'll turn myself off now and hand over to you.
That's great, Adam. Thank you. So hello, everyone. I'm going to talk about a bit of an overview about what SPIND is, and before I start talking about SPIND, I want to talk about some of the other networks that were funded. So I'm going to skip forward a slide or two. If we could just move the slides forward. So SPIND is one of 4 funded networks. They are called Dementia Network Plus or Dementia Connect networks. And just to sort of go an overview of those, the first one is Empower. This is focused on when people with dementia need more care, and it looks at end of life and palliative care. Then there is Working with Dementia for people diagnosed with dementia while still at work, and their network's launching in a couple of weeks. And finally, there's Equidem, which is all about inequalities in access to diagnosis and care. They similarly have a flexible fund, which opened on 31st of January and closes 31st of March. So just FYI, keep an eye out for that one. And which is ours, which is called SPIND. It does have other names, but we've finally set on the final name, which is SPIND, which stands for Sustainable Prevention, Innovation and Involvement Network for Dementia. Its focus is about brain health, maintaining well-being. And this opened originally on 31st of January, and it closes, our network fund closes on the 31st of March 2025, which we're going to talk about today. Next slide, please. So a bit more detail about what SPIND is. A lot of content on the slide here, but basically our aim were twofold: to look at dementia risk reduction, co-production, and early support. And I'll give you more detail about those as we go through the slide, and you'll hear more from my colleagues today. We felt from this network that we would build on the exciting work going on around dementia prevention, particularly the Lancet Commission and new policy papers that are imminently appearing. And our approach is to try and empower, invigorate patients, partners, and the research community to go further. Next slide, please. So here are our themes, just I'll do a whistle-stop tour of these. So we have a sustainability theme, which is about building collaboration, developing the research workforce, supporting adaptation and reducing waste. And also we want to try and maintain the network beyond its 4-year funding period. The next theme is prevention, which is looking at modelling and better understanding of modifiable risk factors and early support and detection, and trying to consider in themes reducing the excess disability related to distress and dementia, and looking at stigma and diversity and barriers to engagement. Finally, there's innovation involvement. Innovation is harnessing new ideas, med tech, and using a number of vehicles such as this one we're talking about today, which is the flexible funding, but also knowledge exchange events such as conferences and sandpits, which is got one coming up on the 3rd of March. We'll be having more sandpits, so watch out for those. The involvement part is the most important part. We are a diverse group across 14 universities, have about 35 co-applicants. We have industry partners, charity partners, NIHR network partners, and we have some international links as well with the World Health Organization, Alzheimer's Disease International, and Interdem. Next slide, please. I'm going to hand over to my colleague Georgina now. I'll pick this up, actually. I think I've jumped around a bit. So how can we think about prevention, which is useful for the funding? So prevention can be categorized into primary, secondary, and tertiary. Primary is areas of risk reduction and resistance, such as head injuries, midlife protection, as indicated there. Secondary is early detection and reducing the midlife modifiable risk factors potentially. And then tertiary is those with established diagnosis of dementia, what we can do to try and mitigate the distressing symptoms, slow down progression once you have an established dementia diagnosis. Next slide, please.
I'm afraid that's all your slides, Chris. You don't have any more. We're on to Georgina.
I got a bonus one though. Thank you, Adam.
I've got a couple of questions actually before we hear from Georgina specifically about the call, which is what are the real objects for anybody who's watching this, who this is the first time they've heard of SPIN-D until the funding call, because many people kind of watch for the funding calls, don't they? And then so they might have heard about the funding call, but not necessarily about the network. What are some of the kind of short and long-term aims for the network?
So I think in the short term, we are trying to invigorate the research community to provide some funding where it's difficult to get funding in relation to brain health and prevention. But my long-term goal is to try and be part of 3 very large research programs, which some of the other Connect Pluses in intravenous diagnostics have been successful in, and this would be over the latter lifespan. Some of the other events are we're merging with other entities and fusing and creating some combined events. So next year, for example, is planned perhaps a very large medtech brain health involving the health tech research centres and our own network and industry, somewhere central-ish where we can bring the research community with business together and look at potential collaborations across route, and also bring patients to that to help businesses co-design in brain health, because that is a key area. Getting innovation right for the patient, not just right because you think it's a good idea. You've got to have that co-design, co-shaping, collaboration aspect of it. So and the key thing is empowering collaboration across as many areas as we can. That's my view.
And is that with a particular focus on any one thing? I mean, is this looking at kind of lifestyle, or are you particularly interested in technology, or is it how healthcare kind of interacts with people in midlife? Is there a particular space there that you're very interested in?
It really depends on the community. So we are an entity, we would probably take anything goes basically. So we're quite open, and then we will see what we consider that has potential, but also if it aligns to what our other network members feel is appropriate. So we'll be filtered any application, peer reviewed, and then we'll consider the opportunity and would that lead to something bigger. I mean, our interest really is not just for one person to apply, get a paper and disappear. We want to look at the next step and how we can be part of that journey.
So all these networks and the ones you mentioned at the start, which I know we're involved with, the dementia researchers we're involved with ECODEM as well, is really about kind of trying to bring together those researchers that are already working in these spaces to come together and to collaborate, and also as well, I guess, to attract new people to the field as well. Is that one of the hopes?
So early career researchers are across all of the Connect Pluses. I think they all have a theme of that, and empowering the workforce and giving opportunities for those who think it's just too difficult to try and lead a grant. That's why the amounts are quite small. And once you've tried one, then you build.
Yeah, absolutely. And obviously the NIHR recently has put a big emphasis on multiple long-term conditions, isn't it? And you can't help but think that bringing together people that already work in other areas like cardiovascular health or in public health and things, and attracting them to the challenges that Alzheimer's and dementia particularly presents is, and having a network like that to help do that is a great idea.
Yeah.
Okay. Well, thank you very much, Chris. I know you're not going to be able to stay with us for the whole thing and the Q&A at the end. So if anybody's watching has a particular question that they'd like to be answered by Chris, make sure you get that in before 12:30, and we'll make sure that Chris is around to be able to get an answer to that question as well. But now we're going to hear from Georgina, who I think that's not Georgina. There's Georgina. Hi, Georgina. We're going to hear from Georgina now, who's got some more slides. And you're going to tell us specifically about your Flexi grants and how they work and how people might apply. Is that right?
Yes, that's right. Yeah, I'm looking forward to seeing which slides you've got here, Adam, because I think that would have been one of mine.
I used the introduction slides as the cutoff, so hopefully we've got yours here. Let's see. Oh no, that's still Chris's slides. There's Georgina's slides. There we go. Okay, over to you.
Thanks, Adam. So welcome everybody to our webinar today, and I'm going to be saying something particularly about our flexible fund. The call opened at the end of January and will close at the end of March, and then there'll be a round 2 of our flexible fund planned to open at the start of next year. And to give you to forewarn you, I suppose, we're expecting that the one that comes out next year will be broadly similar to this year's, but with adaptations made depending on what we learn sort of this time round. So Adam, next slide, please. So we've got 2 funding streams. All of the Network Pluses have these flexible funds, but they're all designed in slightly different ways. So for our fund, we've got 2 streams. One is called Inclusion in Practice, and the other is Proof of Principle Research. And I'm going to give a little bit more detail about both of those. Within the Proof of Principle Research, that encompasses monies for access to data, big data funds. And we've already had a question that asks, is it a requirement that people wanting to apply for the Proof of Principle Research attend the sandpits? And the answer is no, it isn't a requirement, but the sandpit is being held within the window for the funding, so that if you are hoping to apply for monies for repurposing or developing sort of new interventions, so you have the opportunity to attend the sandpit should that seem relevant for your project, because we hope that the sandpits will help with enhancing the quality of the bids and also building networks. But it certainly isn't a requirement that one attends a sandpit, because it might be just an irrelevance to the nature of the research that you're looking to do. So for all of our applications, we're hoping that people will show some kind of consideration of the things that Chris was just presenting as important to this network. In other words, some kind of awareness of sustainability, prevention, innovation and involvement. But obviously the balance to a greater or lesser extent will depend on the nature of the research that you're submitting. So let's move on to the next slide, please. So in terms of our remit, we are in this area of dementia prevention. And as Chris described, that might be primary, secondary or tertiary prevention. As Adam was alluding to, some of the area of prevention is around behaviour change, but we certainly aren't limiting ourselves to an expectation that each individual takes that everything is sort of burdened upon each individual, every individual one of us to be changing our behaviours. Behaviour change might well be important for individuals, but in actual fact, the societal expectations and the environmental possibilities are also relevant to dementia prevention as well. So we're defining behaviour change as a change in human systems for social and environmental good. We're not just pinning behaviour change on individuals. And the kind of things that people might apply for might be for new understandings from the data. We're particularly interested in work that involves previously underrepresented populations. It might be through new technologies or repurposing existing technologies. And it might be around implementing something that's already had a certain amount of, sort of pilot work, or indeed has a strong evidence base but hasn't necessarily yet made that into a standard provision for health and social care. Next slide, please. Oh, there you see, it repeats. It repeats. We can move straight on. Chris has done that one. So starting with a little bit more detail about the Inclusion in Practice Fund. So the amounts that are given here are taking into account that all of the money within the fund is issued according to the UKRI rules, which means that 80% full economic cost. So the range for the Inclusion in Practice Fund is in the region of sort of 400 to 1,000. If people want to put in a bid for less, that's okay. Or if you want to put in some more, we can possibly sort of move up to around somewhere around 4,000 for this fund within the full economic cost envelope. So the kinds of things that we envisaged would be relevant to this fund are things that focus on co-production work. We're expecting some kind of PPI involvement for both streams, but this stream in particular, we would be expecting really strong co-production. That the information, the data gathered, or the research undertaken, we hope might inform future bids. So this might be sort of funding to fund travel to focus groups, or help with costs for support for the person with dementia while a carer is active, or support for the person with dementia to be able to engage in those sorts of focus groups, for example. Involvement of new stakeholders, or this fund could also be used to be part of that knowledge exchange that we were talking about, so to inform or support dissemination of previous research findings. And we'd be really pleased to see sort of creative use of that. So, for example, through videos or animations, not just in sort of text-based reports. So next slide, please. So moving on to the larger fund, the proof of principle research. And so to give an indicative window, we were thinking somewhere between 12 and 24,000. And then there's a kind of optional additional extra possible here, which is to also apply for the data access if you were putting in to be doing a big data project, but also needed funding to be able to access the specific database that you're interested in. We have some monies for that too. So the sorts of things that we might expect within this fund might be around generation of new evidence, whether that's qualitative or quantitative. It might be undertaking some kind of secondary research, so whether that's around reviews, scoping reviews, meta-analysis, or reanalysis of previously published data. This fund would also be the one to go for if you were looking to pilot some new kind of innovation or technology of some form, or to do that kind of proof of concept work. It might include mobile or e-health applications, so it might have actually technology, but we're thinking of technology broadly in the way that the health technology assessment would. So it might include new psychosocial, educational, or contact kind of interventions. To say a little bit more about the existing large data sets, we have a partnership with SPINDI with the Protect group, and on the website there's some additional information about how one would identify the what data is within Protect, so what the data directory has got in it. But we'd also be willing to hear from people who might want to take further analyses on any of the other large databases that there are, the long-standing longitudinal cohort studies, or some of the things that have been more recently set up that really have quite rich data relevant to dementia prevention. Or it might well be that there's data sets that we haven't particularly come across, but are held within commercial or voluntary or charitable sector organisations. So next slide, please, Adam. Thank you. So the kind of criteria that the funding panels are going to be using to make decisions about who to fund. There's two separate panels, one for the inclusion in practice and the other for the proof of principle research. But the assessment criteria for both are broadly similar in that we want something that's within remit for SPIND. We would like people to take account of network priorities. I'm going to say a little bit more about that on the next couple of slides. That we want all to have some PPIE involvement. We would expect more co-production for the inclusion in practice, but certainly to have some kind of PPIE involvement within all of the proof of principle research as well. That we're looking to involve more people in this network and to strengthen the network. We're keen to see some sense of where people would be wanting to go to next. I mean, obviously, we don't always know for sure because it depends on the outcome of the research, but we want to have an idea that people are looking to create some kind of pathway to impact or development of ideas of where the research would go to over time. We're particularly looking to be supporting early career researchers, and we're using the ESRC definition of early career researcher, which actually goes all the way up to associate professors. So we're not talking about limiting things to early postdocs here. It's basically anybody who comes under the ESRC definition of early career researcher. We want to make sure that people have got appropriate collaborators, and we hope that within people's vision for the future, that might include where they might look in the future for further funding. Other expectations are that people have taken into account equity, diversity and inclusion. And indeed, if we find that we've got a number of projects that have been rated very similarly by the funding panel, we have included in there that we're looking to get a diversity of geography in terms of the funding that we distribute as well. Okay, next slide, please. So I said I'd say something a little bit more about network priorities. So I've got a couple of slides on this. For the first one, say that one of our first exercises within the network was a prioritisation exercise where we were looking at previous PPIE involvement in priority setting in this area. And in actual fact, we've still got a little work ongoing with this, but Christine Liabu, who's leading this work from Exeter, she has produced a summary document of some of the reports that are relevant to this, and that's available on the website. And the other things that I've got on these two slides are the kind of things that we flagged up in our bid when we were putting the bid into the ESRC, of the kinds of things that we said we'd be supporting within the network. So I'll simply read those out from this slide in the next. So relevant to understanding or awareness of culturally appropriate strategies to enhance brain health, to lead improvements for people with or at risk of neurocognitive disorders who at the moment might be avoiding services due to fear or stigma, to be widening participation to unresearched or under-researched groups, for example, minority ethnic groups, LGBTQ+, severe mental illness, learning disability. We'll see whether we can, I've just noticed that there's thank you. I've seen there's a question, and then I think we can provide a link, can't we, on the ESRC's definition of of an early career researcher. But like I say, it's basically anybody all the way up to associate professor is the short version of it. Should we do the next slide, please? So to say a little bit more about network priorities, to be identifying influences and inequalities throughout the life course that might shape cognitive function in old age and in later life, to be understanding the impact of awareness raising around risk reduction, given that dementia is a condition that carries stigma and fear. If we take certain approaches, might there be unintended consequences? So I alluded to that earlier, where I was saying that if we place the expectation of behaviour change simply onto an individual, then are we adding burden rather than empowering people? Some people would find knowing that they changing behaviour might have an impact on dementia risks, they might find that empowering. Other people might feel as if it's yet another sort of burden being added to their lives. So we need to be considering some of the implications of the actions that we're suggesting. Are we inadvertently at risk of increasing stigma or increasing fear-fueled avoidance? So we do expect people to perhaps consider those kinds of psychological factors in the interventions that they might suggest, for those of you that might be suggesting interventions. So what barriers might there be to modification of lifestyle behaviours? How can we improve understanding of the impact of different kinds of care and support available to people in the immediate post-diagnostic period? What can we understand in terms of the cultural barriers that there might well be to expecting people to engage with, or for services to implement risk reduction strategies? And as we mentioned earlier, we're keen that where a start is already made, we build on those starts that have already been made, rather than feeling the need to start everything anew. So we're keen to build on past findings, whether that's reusing or repurposing existing research, but also making sure that we're in our dissemination strategies and implementation toolkits, taking notice of what's already been produced rather than just beginning from the beginning. Okay, Adam, have I got another one, or have I got to the end of my slides now?
No, that's the end of your slides, Georgina.
Oh.
I've got lots of questions.
Just in time for Chris to ask one quick question before he disappears, if he's there.
I've got lots. I mean, we've started to get questions in. Do keep those questions coming for anybody who's watching. I think we're going to save up the questions on that until after we've heard from William, and then we'll address all the questions afterwards. So next we're going to hear, I think, from William, who is going to talk about sandpit events. Maybe could you just help to start with? I'm going to bring William in, but could you just set a context for this? Because I'm conscious that we've talked about the network and we've talked about the funding call. Where do the sandpit events sit in the scheme of this?
Should I come in on that?
Yeah, do, William, by all means.
Firstly, hello everyone. I'm, as I said earlier, William from the Health Innovation Network Southwest. Really quickly on the Health Innovation Network Southwest, this is exactly what we do. So we help to accelerate the adoption of innovation. That's what we're sort of our role in the system. For those unfamiliar, do check out our website. I can put a link in. If you're unfamiliar with what we do, we're funded by NHS England and the Office for Life Sciences, and we're really proud to be a key strategic partner in SPINDI. We're there to really help translate fantastic evidence and research into practice and help bridge that gap. And so we're really excited to bring our expertise in how do you accelerate that process from research to adoption. You know, it's full of bear traps and pits and challenges. How do you overcome those barriers? So we're bringing all of our expertise and knowledge to a set of sandpit events. So folk might be familiar with that phrase, but really it's all about how do you bring lots of different diverse perspectives together in an event, often face-to-face, but not always. And how do you bring all of that knowledge together to try and shape and change and or help influence your hypothesis, whatever it might have been. So hopefully by the end of a sandpit, your hypothesis will be enriched with varying different perspectives, different vantage points, different angles that you might have not considered in your original piece of research or within your team. So it should be quite a challenging experience. It should really shift the dial in your thinking. And that's where they sit. And they sit in this program as an opportunity to really help us think differently about dementia research and prevention, and recognizing that, you know, and hopefully help shape the funding proposals that are going into the flex.
That's where I was getting to before we. I know you've got slides which we'll come to just add some context to this. So The sandpit events that you're going to talk about, they run complementary to the funding call. They're not.
Yeah, absolutely.
So they're not. It's not like a requirement that the funding applications are an output from
No.
the sandpit. But if you're thinking of applying for this and still would like to noodle around your idea, would like some support, some input, the sandpit can complement that. But they could also
Yeah.
happen independently of something if you're planning to apply maybe next year or just want to get involved in the network of somebody else's
yeah.
application.
Absolutely, it's not a
Right.
prerequisite. It's just a really great opportunity, hopefully, to help shape your thinking, and as I say, bring all of our different expertise from within the network, but also within our own
Well,
organisation.
why don't I let you? I'll shut up and let you get on and
Oh,
bring
well,
your slides. shall we?
Georgina.
I'll bring them in.
Oh,
Oh, wait, Georgina.
well,
I'm
then,
sorry.
Well, I was just given that I was here on screen, I was just going to say that
Yeah.
there will indeed be some sandpits that fit within the bid development more easily than others, and
Yeah.
some will be kind of will be outside of that, because we're only having 2 rounds of calls, this one and the one that will open at the beginning of next year. Yet over the course of the SPINDY programme, which runs until the end of March 2028 in the first instance, we've got funding for somewhere around 6 or so sandpits. And so some like this one are happening within the time that the call's happening. Some might be in preparation for a future call, and others might be to, depending on where we've got the flexibility to respond depending on what comes up. So if, for example, there were some ideas that we were really keen to pursue from this very first sandpit on the 3rd of March, I think we've got the option of potentially working with the people, some of the people from within that sandpit to then do further development work. I think that's
Yeah,
that we're
I
in.
guess the timescales are a bit tight, aren't they, between this first sandpit and the deadline on the first application? Yeah. Well, let's hear from William on who can get into that. I know you already made a start there. I'll just bring you up, William, and then we'll get to the big discussion at the end.
Yeah, thanks, Georgina. I think this is very much recognising this is the beginning of a journey as well. So this is our first one, and it is trying to get in there to help influence and shape those proposals where people have the opportunity to attend. But yeah, this is going to be a journey of the next couple of years, and hopefully, as Georgina says, there'll be a number of these as part of our programme. But really quickly on that second, so if you move to the next one now, Dimber, I'm assuming you can control the slides. Excellent, thank you. For those unfamiliar with an innovation sandpit, there is a lot of different types of events out there that essentially do something very similar, which is how do you accelerate your thinking? How do you bring different viewpoints and perspectives to the idea that you're developing, and how do you do that in a structured way so that you can really refine and shape it and change it potentially? So a sandpit, an innovation sandpit, is in effect an approach that's been trialed for many years, within particularly in research, but there are other methods like hackathons, accelerator programs, all designed to do very similar things. And really, it's to create a safe space, a safe, confidential space where you can challenge your thinking, experiment, test your hypothesis, as I said earlier, in different environments with different people. So this is what we're trying to do, particularly in recognizing one of the key sort of principles of SPINDY, which is bringing user perspectives, the voice of the patient, the resident, the citizen, to the heart of what we're doing. We know in research and innovation that the more you involve the folk that are going to be ultimately benefiting from this intervention into your work, into your research, the more successful it's going to be. And we see that all the time in our work at the Health Innovation Network. The most successful projects are those that have really built in things like PPI right from the beginning, not later on, but right at the beginning. So that will be one of the key features of the day. We're going to have different people with lived experience, different people from the service, different people from the academic world, all in the room, all together, trying to help accelerate and advance and hopefully improve your thinking behind your research project, maybe your intervention, might be a technology, whatever it is. And hopefully you'll come out of it with some great new contacts. You'll make connections with us as a Health Innovation Network in the Southwest. We're part of 15 networks, by the way. So if you're in a different part of the country, by connecting with us, hopefully we can facilitate connections with the wider network in England, but also those that work in Scotland and Northern Ireland and Wales as well. There are similar organisations to us, and hopefully throughout the day we can help build up your network, your connections, your relationships. As I said, key to this is designing for need. So that'll be one of the key sort of, returning lines in the day as we facilitate it will be, what needs, what unmet challenges or problems is this truly addressing? What's the compelling need for this intervention, this research? And hopefully at the end of it, your proposals you'll have some eureka moments, some penny drop moments. I love that when those happen in groups and things. Hopefully you'll have some of those moments which will help really, improve your proposals that you might take through to the deadline on the 10th, or indeed to other deadlines that that will be as part of the flex funding over the next year. Well, for the second round in the next year. So next final slide. And thank you, Adam. So as I say, we've heard a lot about the focus. So the day will particularly look at the themes that we've already heard a great amount of from Georgina and Chris earlier. So as you can see, repurposing and redesigning for brain health in your generation is the thrust of the day. It will be in our offices. We are making some provisions for those that can't join us in the building. So we'll be using a little bit of hybrid, but we're really encouraging where possible for people to be there in person. And there will be some provisions to support, I think, our researchers within the team. And of course, this is partly thinking about the cause of expressions on the 10th, so not very long after, but hopefully it will be additive and helpful. And we've already had some great responses for initially attending the day, but do get in touch. It's not too late. We have a little bit of provision within the day, so do reach out. This is quite a focused event. It's really for those that have projects, research projects, and interventions they're trying to develop. But do reach out to Emily, whose email is there, if you want to attend, and hopefully this has inspired you to be involved. Everyone we've done has been so powerful over the years for our researchers and innovators that we've been working with. So yeah, really excited to see any of you there, and indeed to work with you on the future sandpits that we hope to run with Chris and the team over the next year. I'm going to stop there and hand back to you, Adam.
Thank you very much. Okay, so that's the presentations part of today over with, and now we're going to bring everybody back to take your questions. So I know we've already got some to work through, so by all means do post your questions, whether that's about the network as a whole, whether it's about this particular on this flexible funding call, or whether it's about the sandpit event. Please do post your questions now, and we'll start to work through them. Sorry, Georgina.
Yeah, I want to apologise. I've just spotted that there was a typo on that slide that William presented. So what it should have said is that the sandpit event, the calls, it's my fault because I did the slide. It should have said February, that they shut on the 10th of February. So we did have our round of applicants.
Yeah.
So, and you'd very kindly, Adam, put up the QR code for the sandpit. I suspect that form isn't working at the moment because we did shut expressions of interest for the sandpit on the 10th.
But we're saying it's too late. If you watch this now and you go, oh, I really wanted to go to that, can they still?
Well, that's right. So we had a really good response, and if we go with the people that we have the response, that will be good. What we're not sure about is whether everybody that put in the expression of interest will indeed be able to actually make it to the event. So if you've heard this or you're listening to this not live, and you're really interested to attend the sandpit, do contact Emily and ask whether there might still be spaces, because if we can squeeze people in, then we will do.
Great. Perfect. Okay, shall we start working through some of our questions? And I've got some written down here as well. So we had a question asking what the definition of an ECR is. And if you're watching on YouTube, I've posted the link that helps with that. But I think, Georgina, you did clarify, didn't you, that essentially it's anybody pre-tenure by the sounds of it. I mean, it's prior to being associate professor and below. There's no, I think they do put do they put a limit on how many years post PhD you're supposed to be? Do you know?
Well, the trouble is that I think Yes and no. It depends what your PhD was in. Some people have done a PhD in something and then moved into dementia later. So they might well have been a postdoc for quite some time, but not necessarily in this field. So basically, there's quite a bit of flexibility about what counts as an early career.
Some open to interpretation on the rules. Thank you very much. So that answers your question, hopefully, Rachel. And we've got a question from Golnaz, which I'm going to flag up on the screen there briefly. This is a good question. An ECR based in the Netherlands, currently undertaking a fellowship in the UK. If you collaborate with a UK-based advisor, would they qualify? Or so? Good question. Overseas
To
student
Emily. Over to Emily. I think you know
on a
the
fellowship in the UK, can they apply?
So, so it's following ESRC rules that we have to follow. So we have to allocate the lead applicant has to be somebody who's based at a UK institution. So they can be international, but based at the UK institution, that's fine. So if there is scope to include international co-applicants.
That makes sense. So as long as you're applying at the institution you're currently working at, not necessarily a European institution, you can apply. It doesn't matter that you're
exactly
where you studied from, but you have to
Emily,
apply.
Is it to do with where the money would need to go? So the money would need to go to the UK.
Yes, exactly. The lead institution must be a UK one.
Yeah. So for Golnaz, if Golnaz, for example, were based at a UK institution for their fellowship, they could apply from that institution as long as the institution was willing to accept the money, and then they could do the work even if she herself had gone back to the Netherlands, for example, at the time that it was being carried out. Is that right?
Yeah, I mean, I guess
that's typical on most UKRI.
Yeah, I mean, I think as long as the UK institution is receiving the funding and that the person is employed by that organisation or connected with it through a studentship or something, then
well, that's the perfect segue to my questions actually, which was how long do you expect this grant to run for? When does this work need to be concluded by?
So we're expecting the projects to be completed within 12 months. We're hoping that each project will be able to be set up and be ready to start by September of this year, and then would run for up to about 12 months.
And then that brings up that kind of question, which is often a factor, which is to apply. That means are salary costs allowed to be included in this?
Yes.
You can include salary costs. Okay. Obviously, the pots aren't so huge that there's a great.
No, they're not massive. So yeah, but you can include salary costs if you wish.
So you can put some of your time costs in there, but usually for ESRC grants, you'd have to have or your institution will probably require you to have a contract that's at least the length of the grant you're going to apply for. So if you're currently on a short-term contract that's going to finish before this grant would finish, you might find your institution won't let you apply. But that'll be your institution, not the ESRC, that restricts that, most likely. Let's take another question from the audience, which is, can you apply more than once? So can you apply for both funding calls? Could you apply for like your dissemination and public engagement grants and one of the larger ones as well? Or can you put in more than one application with different ideas?
Who's answering that, Emily? Okay. The answer is you can apply. You can apply for both funding streams. You can't apply as a lead twice within the same funding stream. Is that what we put, Emily? Yeah. So it's fine to apply for both. Do bear in mind, though, we are if all other things are equal, our decision making will take into account the breadth of the breadth and the geography. So yes, if you were to be the lead within each funding stream, well, each committee,
you've got to deliver on both things as well. I mean, that's something to both.
Looking at them.
Would you see then a scenario where somebody applied to both, but in a bit of a combined way? That it was kind of a single, you join up your projects, so it had an element of both.
As long as it's clear which fund is
Or would
being
it be better
applied
to just
for.
do two separate applications?
It probably it would be entirely fine to make reference to another application, but bear in mind that the innovation in practice panel is separate from the proof of principle panel.
That makes sense. So let's. I'm just going to flag that slide. I'm going to bring that slide back up very quickly. So this is, you can put one application in for the inclusion in practice fund and one application to the proof of principle.
Yeah.
Fund.
And you can put in more than one, but you can only be the lead for one in each of those.
Right. So you could be named on more than one, but only the lead on one. Oh, I think that makes sense to me. Which also, again, we've got another question, but this leads me to a question that I had, which is, where do you sit on fundamental science biomedical research? Because obviously there is lots of work in that space on prevention that might be using samples from, say, like UK Biobank and things, looking at risk factors. Is this more in the qualitative and tech space, or is clinical biomed research within scope?
As long as it's clear in the application how it relates to brain health or prevention of some form. So we wouldn't be funding anything that was just, oh, here's a technique that we want to try, or here's some. I don't know enough about biology to even know what all the right vocabulary is, but just in case people are then wondering, when it comes to reviewers, we will find reviewers that are relevant to whichever topic it is that you put in for. So the answer is, it's not a no, but it needs to be clearly something that relates to sort of brain health or prevention. So you need to be able to make the case for why it's relevant.
Absolutely. And so that kind of, I think, maybe addresses the next question, which is, would there be scope to apply for funding to cover reanalysis of samples, example sequencing, or I guess neuroimaging?
Yes, as long as the case is made for why it's relevant to dementia prevention or brain health. Yeah.
We've got another question about career stage, which is, what if you haven't finished your PhD yet?
That's okay.
What if you're still doing your PhD right now?
Doing your PhD right now, it's fine to apply for either of these funds.
Great. And then we had another question, which I'll flag up on the screen briefly there. Can collaborators be researchers from universities outside of the SPIN-D network?
Absolutely, for sure. We positively encourage that.
Absolutely. So essentially, I mean, I'm guessing collaborators can be, as long as the lead is at a UK institution, collaborators could be anywhere across the world.
Yeah, they could.
And going back to, I guess, to William's point and the one that Chris made at the start, they don't necessarily have to be in the academic space either. They could be in health tech, industry, or in the private sector somewhere.
Yes, as long as there's some link with an early career researcher. Is that right, Emily?
Yes, I mean, the applicant has to still be the early career researcher in the UK institution, but other organisations can get involved through being a co-applicant.
And a strong component of that, whichever space, whoever your collaborators come in, would you expect to see people with lived experience as collaborators, or do you need to just demonstrate that you've co-produced or done your patient and public involvement, or would you like to see them as partners in the actual research?
So I think that there would be, we definitely want to see involvement with people with lived experience, and probably through organisations that work directly with those people.
Yeah, okay, that makes sense. Keep going. The questions are brilliant today. Well done. I'll keep these questions coming. What about if another career stage question? You're doing a master's, not doing a PhD.
I think we don't have any objection to somebody applying who's doing a master's, but you need to bear in mind the timescales, which is the project is unlikely, the project funding is highly unlikely to be available until September time this year. And then, so you just need to think about where somebody who's on a master's, we might expect that they would have finished potentially before the funding might even arrive. And so would the institution be willing to accept being in receipt of the funds? So it would be a discussion more with the university that you're at, and perhaps identifying somebody who's still likely to be at that institution beyond the masters. So I think we don't have any objection. We're happy for all career stages that people fit in with early career researcher. I think people have also flagged up that perhaps the SRC definition is talking about sort of later PhDs, but we don't mind what career stage people are at, but your institution might do.
I think that'll be the challenge for any master's student, isn't it? Is getting the support of your institution to actually support your application, because of course the money doesn't come to you, it comes to your university. And to for those of you who are doing a master's or a PhD or think applying for this, I would strongly recommend you chat to your supervisors before submitting, because they'll help you navigate the application process, because you are going to have to put this into your university system to get the proper costings that you're going to need. Otherwise, I mean, we've got lots of webinars and blogs and podcasts and things to talk about how to do a good application, and a very common one that comes up really often is don't be overly ambitious. You've got a limited amount of funds, you've got 12 months to do it, and you need your university sign off. So keep this realistic. And if you need any help, I can post comments afterwards to those resources that might help you with your application. So we've got another question, which was, where do you sit on reimbursement or salary for PPI in terms of amount? So
we would absolutely expect PPI contributors to be reimbursed. The level of reimbursement is likely to be influenced by your institution's policies, because most institutions will now say, what level of reimbursement at all rates, but they have gone now. And so, yes, we do expect PPI to be appropriately reimbursed, and it might be something that you'd like to mention in your application about how you came to the decision about what rate it was that you're suggesting in your application.
Brilliant. And then we had another question now, which is from somebody we probably know. Can members of the SPINDI network be collaborators? So somebody who's already involved in the network.
They can, yes, absolutely. They can be collaborators, but people who were named on the original bid can't be leads. Is there anything extra to add to that?
They can't be in receipt of any funding.
There we go, even more than that, in receipt of any funding.
And then we've got another question now, which is, how many projects are you aiming to support?
It all depends how much money everybody applies for. So if everyone goes for upper end, we'll be supporting fewer than if we've got a range. So obviously we're wanting to try to make sure that we make our money go as far as possible. But roughly speaking, 6 out of each funding stream, but it might be more if people apply for less.
That makes absolute sense. Next question. Are you supporting research focused on enhancing post-diagnostic quality of life? For example, initiatives aimed at reducing falls or improving interventions such as rehabilitation following fragility or a fracture?
Yeah. So we're looking to... How's the best way of responding to this? That's an it depends one, because we're not looking to get involved in applications that would come under the Empower network. They will have their own flexible fund for people who are in need of more care. So that would include, I think there's also been a question about residential care. So we wouldn't get involved in applications that are relevant to residential care. or for people who are in any other kind of hospital or institutional living, and nothing that is to do with people who are in need of extra care due to frailty. However, we are interested in post-diagnostic if it is there to prevent deterioration or to enhance quality of life. So if we're talking about falls in somebody's own home or delirium prevention for people who are living at home, then we might well be absolutely fine with that. So that it depends how you write that one.
So I guess people who are at greater risk that we know, because there's evidence to support that people in certain circumstances after a health intervention or issue might be at higher risk of developing cognitive impairment, say after general anesthetic, for example, or as you say, after a fall. So as long as you can make that connection back to prevention and risk factors, that's the key.
Yeah.
If it's something else, I'll flag the Chris's slide up from very early on, very briefly. So for anybody watching, there are SPIN-D is one of four networks, 4 Dementia Plus networks. There's the Working with Dementia, there's the Empower, and Equidem. 2 of those networks, the Empower and Working with Dementia, I think are a little bit further behind in getting started, but Equidem is at about the same place where SPIN-D is, and they have also at the same time launched their flexible fund, and it's much the same concept, it's the same rules, except they're particularly interested in inequalities in dementia care, particularly. So if you're thinking about an inequality, that's the other one. And the details of this are also on the Dementia Researcher website. If you go to our funding listings, you'll find details on that funding call there. Right, so we've got a couple of more questions, and then we'll have to probably think about wrapping up. Although I want to ask a couple of things about the sandpits as well. Can projects be directed at interventions that prevent conditions that lead to dementia, such as delirium?
Adam, if there's something you want to ask about the sandpit, you might need to do that first, because I think Will needs to head off any moment.
Oh, do you? Sorry, Will. The questions I had about the sandpit was, you mentioned that these can support applications. If anybody's got an idea right now and can manage to get in on the March one, what practically do you do on the day? What practically is involved? What do they come, and is this like a workshop? I mean, do you support them to develop their ideas?
Yeah, absolutely. All of that. I think there will obviously be an opportunity to go even deeper into some of the thematic areas and the priorities that Georgina and Chris went through earlier. So there'll be an opportunity to go even deeper into some of that, and an opportunity to hear and connect to that team more deeply in the first part of the day. And then, we'll bring some of our methods. Don't want to reveal all of our secrets, but bringing some of our methods throughout the day, particularly in the second half of the day, where we really want to progress the projects. So we'll be breaking people into groups, bringing different perspectives into those groups, and using some of our methods to get different perspectives, and hopefully finish the session with, as I said, more penny drop moments where people start to maybe rethink their hypotheses a little bit in a positive way as to how they could develop their project into the funding and beyond, because they might decide actually not to apply, because that might happen sometimes, and it's better for them to think, do a bit more of the thinking before they come back.
Will there be some people with lived experience, members of the public there as well?
The hope is yes, absolutely, but through some of the methods that we use in the afternoon session, we will have that voice of the user at the centre of the centre of the thinking that we do. But absolutely, I think we're going to try and do our best to ensure there's good representation.
Wonderful.
And if people want to bring people with lived experience as part of their projects, that's fantastic. Obviously, speak to Emily in the team here as to the logistics for that. But
and so if you're too late and you can't get in on this workshop, or you're thinking about applying to this fund next time, there are going to be more of these sandpits through the year.
Well, there'll be more of these, yeah. And I think, as Georgina said, not just for the funding. I think the principles of SPIN-D are all about how do we bring diversity of thought to the projects and the research that we do in dementia, isn't it? So I think there's going to be a range of sandpits, and there will be other funding calls outside of the network. I think Georgina alluded to that. We really want to support projects. So I think we'll be using this idea of a sandpit and running a number outside of our funding calls, but this is our first. It's an opportunity to really see if we can bring a little bit of a different
I
perspective.
noticed, Adam, that somebody's asked a question about joining the sandpit from Scotland. I think for this one, wherever possible, we're hoping that people can get there in person. We will be running some online only sandpits because the nature of the sandpit work, it's actually easier to have all or none rather than hybrid.
Yeah.
So some of the sandpits will be online sandpits, and so we would really encourage people that aren't able to access because of geography and distance to.
You could see it would be great if an output of that was some people bringing people together from diverse backgrounds to work together on something new. So whilst you might arrive as an individual, you go away as part of a team with something to work on. And as you say, not necessarily even for your grants, but then to apply, if you can bring people together that are going to find more funding elsewhere, whether that's from one of the charities or Alzheimer's Society, of course, who we know are a co-funder and supporter on this Network Plus scheme. It would be great and an opportunity to do that by participating in those sandpits. I'm conscious of time. We've got a couple last questions, which is would interventions targeting care home settings? I think we've already answered that, Frederica. If you're a little bit late to joining, you might want to catch up on the recording, but I think we've answered that question. And there was one more as well, which was about
the ethical,
ethics.
The ethical.
People to have ethics.
No, you don't. In actual fact, it's a very good question. We haven't said anything at the moment in the guidance about ethical approval, so we probably ought to be adding something about that, shouldn't we, Emily? So I think we will take that point away to actually have some written down things about the ethics, but we don't expect you to have already got it by the close of the application window.
But of course, I mean, the work you're doing may need ethics. It's just that you're not expecting them to have that in advance of applying.
Yeah.
And bear that in. I mean, we know what ethics committees can be like. We love them, but it might take a little bit of time. So do factor that into your timelines when applying. I think that's probably all we've got time for today, but thank you so much. This is really informative and brilliant to see so much engagement and enthusiasm from everybody watching at home or at work, who I suspect you're going to do really well in terms of how many applications you get based on.
Looking forward to seeing what we get. Yeah.
And thank you very much. So just a final reminder, SPIN-D has its own website, and there's some great recording from their launch event as well, which was last year, and a brilliant patient and public involvement film as well from the people that have been involved in deciding and defining what this network is going to do and what it hopes to achieve. So do take a look at our YouTube channel, or just type in SPIN-D into YouTube and you'll find that film there, recording of the launch. If you want information on the Sandpit event, the one that's coming up, or on the ground round as well, I'm going to flag that QR code at one more time. There we go, on the grant. So if you're watching this on a smart device of somewhere, take a screen grab now and you can see the QR code there.
For me, Adam, it comes up underneath something that says...
I'm pointing you that. There's a QR code here. At the top of the page, there's a QR code. So take a screen grab and do that. We've also posted a link. If you're watching in LinkedIn and YouTube, I'll post the link. And we've already done that in X as well and on Facebook. So go have a look at the criteria, take a look and have a chance to look at the form. Don't waste too much time. The deadline is 31st of March for this and the Equidem funding call as well, which is also open if you're interested in inequalities. And if you have any further questions, if you're watching this and you couldn't watch live and you're playing catch up and you've got some questions that we didn't quite address for you, you can put those on email and you can send them to, I'm guessing they can send them to you, Emily. And what's your email address?
e.permain@exeter.ac.uk. But actually, there's a website that's already on the web. There's an email address on the website, which might be the best one to direct it to, and then it goes to a number of us. It's a shared email.
Yeah,
great.
And I
So
think what we might also do after today is looking at some of the questions that have come up. Perhaps we'll also add to some of the information that's on the website, so people can check that too, rather than
could we, a Q&A? I can send you a transcript and we can maybe make a
brilliant.
Q&A from this as well.
Thank
And of
you.
course, you will also find SPINDY on LinkedIn and their Facebook website as well. So if you want to keep up to date with future grants and events and opportunities to get involved in the network, give them a follow on LinkedIn and you'll get those alerts. And we'll do the best to do the same as well through the Dementia Researcher website. And if you are applying, we've got lots of great resources, webinars, podcasts and blogs and lots of resources to support you in writing a great grant application on our website, dementiaresearcher.nihr.ac.uk. Thank you very much to everybody who's still here. Last of us, to the brilliant Georgina Charlesworth and to Emily Parmen as well. Thank you so much for joining, and we'll see you again next time.